12th of August 2023, the day 1 of Certified Clinical Pathomechanics Specialist course happening right here at the AOMPT Center in Bangalore, held conjunctively together with the Clinical Pathomechanics Certification announced for Pune, and we are awaiting our members Dr. Sujanya and Ritu Sani ma'am to join us on the screen right here on Instagram of the AOMPT. We were there in the Zoom, and now we are looking forward to both of them joining us faster so that they will share their inputs on their experiences on the day 1 and how well they got new information which they'll be integrating in clinical practice. So we got Dr. Sujanya. As she is joining on the screen. Ritu ma'am, let's see whether she's coming. Right. Yes, Dr. Sujanya. Ritu ma'am,
Yes.
was she telling problems like she is not able to come or anything like that? Did she?
No, sir, I didn't receive any message.
Okay. Okay. Because she's not yet joined here. Are you texting her on Instagram and saying what?
Yeah, I can. Give me a second.
So we'll listen from Ritu Sani ma'am first, as she has commitments with her family and her relatives. So she will highlight us short enough, how much ever is possible, and then so that Ritu ma'am can be able to do her family responsibilities. Okay. Now it's almost 6:15 p.m. and this course was a definitive learning experience for me, and listening to inputs from, of course, Ritu Sani ma'am and Dr. Sujanya throughout today. Yes, Sujanya madam is joining. Okay, so you can come back. Yeah. Right. So the dynamic physio. Okay. Hope it is normal mechanics and not pathomechanics at home. Okay.
Pathomechanics.
Oh, yeah. Relatives means always it will be multi-structural. Interdependence.
Yes.
Structural interdependence will be there.
Yes.
Yes.
Yes,
Ritu ma'am?
sir. Yes, sir. I think we have to start with the hippe hurre. That is the right word for the today, because the cherry on the cake or the sweet dish of the full party was the SLR, which you have explained in the last. So that was, I think, it's a completely a different view that people search for the SLR positive, and we are working towards the if SLR negative. So how we can change our thinking process by one step from ankle to knee to hip to articular to myofascial. Then we know that SLR we are checking for the neural, but how can we simply again only check the neural component without treating the articular and myofascial? So whenever we are going to treat for the neural component, it is best to either the work on the muscle activity, contraction with the muscle, or the first step, that is with the, we have to start with the stabilization, the stability part, the motor control, which was a very, I will say the very beautiful. I really like that the way how the maintaining the lordosis with the stabilization, with the motor control, pressure biofeedback, and then we are checking the SLR. Then after giving the patient stability, we are moving toward the mobility. So that is also very important part. Yes, now stability is gained. Now we are working on the mobility. Then we are moving towards the myofascial component, where the contraction of the muscle or training of the muscle is very, very important. or either with the muscle abductor, adductor, or the rotators also. So this pathomechanics also plays a very major role. And yes, I have seen one of my patient when her tibia is in externally rotated, her foot is in external rotation. That time she feel more pain, the sciatic pain. She feel that I am having a pain. So it means I was never checking this in this kind of the profile that I am training the rotators and then I am checking the SLR. So that was also very different view that you have given. Then again with the hip, where the articular, the gliding in any rotation, any position, we can give the gliding to the hip and then we check. Then we are moving toward the sacroiliac or the pelvic rotation or the iliosacral dysfunction versus sacroiliac dysfunction. So that differentiation also plays a major role for checking, because you have, I think, make a bridge from lumbar spine to the foot. That was the bridge in which what the component was coming in between. We have checked all that component. So that was yes. And then yes. And after that, we have to check with the visceral also, cranial also. That also we have to check, because in our so many courses. Yes, sir.
Even cranial, rotate the neck to the right and left.
Yes.
So keep the neck rotated to the opposite side and then do the SLR. Keep the neck rotated to the same side and do SLR. It becomes cranial.
Yes.
Because
Right.
rotation happens in upper cervical. Okay? Yes.
Right. So the visceral part, the cranial part, that is also, I think, very important to check with the diaphragm or with the ribs. So how we can give this LR, treat the SLR, keep the SLR position, and then we check visceral versus the cranial. So this is the things which you have explained today. I think I have never heard these words that we can keep, and I have never seen any article on any PubMed or anywhere. I have never seen. Maybe you have seen, and because you are the master, you can say you have written somewhere. So we want your that particular page. But yes, whatever you have explained today about the SLR, nobody can explain and nobody can understand without taking this video, without taking this course. That is also the very, very hidden truth in between, that if we will not see that video 10 times, 20 times, after that, yes, we will be confirmed that yes, I will write a full page of the SLR with all the things that where I can use it, either with the active SLR, passive SLR, bilateral SLR. So these are the contralateral side, or so many things which you have added today. Like in the prone position also, supine versus the prone position, that is with the gravity dependent position, at arterial, with the venous, how we can check, because everything is there from lumbar spine to the foot. Everything was there, nerve was there, joint was there, muscle was there, venous veins was there, arterial was there, lymphatic was there, visceral was there, and cranial was there. So everything you have added. So it was a beautiful basket which you have given. And really, I am thinking that if I will open my neuro rehab center someday, if my dream will fulfill, so there I will be keep all the pictures of SLR, how we can check the SLR, these kind of the pictures. It was really beautiful view, and thank you so much, sir. And not only this SLR, that was because this is the cherry of the cake, so I am added here first. But how beautifully you have explained about the elbow position, how we can check the patient is having a problem related to the elbow, lateral epicondyle, medial epicondyle, olecranon, bursitis, tendinitis. We can now easily make that triangle which you have made now, with the valgus varus, with the forces, with the supination, pronation, with the extension and the flexion. So that has opened us so many things which were blocked in our brain. So that you have already opened today about the elbow. Because again, I will say I have never listened so much detailed about the elbow from anyone. Although I don't know anybody in the world, only I know you. But again, I have never seen that people taking the course about the elbow. And like our yesterday pathomechanics session, the carpal tunnel syndrome, I have never seen that anybody has explained about the carpal tunnel syndrome better than you. So this was the thing which really, I will say thank you so many times. And in the morning session itself, our cervical spine, how easily now we can make a chart in our mind with the cervical spine patient with the spondylosis or the listhesis or the facet joint or the disc, or the patient myofascial pain syndrome, or the cervical radiculopathy, neural. symptoms and like the double crush syndrome either in the cervical radiculopathy itself. We see that because previously last year I was stuck with the condition like in this that my patient is having a first carpal tunnel syndrome, then cervical radiculopathy. So I was stuck in that time, but after learning from sir, it is clear that who is the primary, treat that one. So this is the way the picture sir has cleared our so many doubts. And today full session with the cervical spine, very because first we have to understand about the spine mechanism, then we are coming towards the upper limb where we learn today more about the elbow and as well as the SLR positions for the lower limb. That is also very, because in this SLR itself you have explained all pathomechanics of the lower limb with the articular, myofascial and neural. It was not a different thing that you have left anything. During the SLR itself you have explained all the pathomechanics, that how the hip movement react, how the knee movement react, how the foot movement react, how the muscles react. So these were the things which were really very useful course and advisable, recommended course, pathomechanics. It's a key of success of all the physiotherapists if they will learn about the pathomechanics. And definitely this today video, I will see again tomorrow. I will utilize my Sunday for this, that I will see full video for today's session, so that where in which steps I have missed, so that I will add on in my notes also. And this SLR part itself, I will see again and again so that I can clear more about, and I will try to be in the perfection side of treating my patient with the SLR, or if they are having a neural problem, sciatic problem, piriformis problem, whatever the problem related to the nerve related, so we can be clear. So thank you so much, and thank you ma'am, you too also, because of your passion of learning, that you were sitting throughout the day, and it was giving me the little relax that ma'am is there now, so I can complete my work. So that was the thing. You have given me a very much good company like the Darshana ma'am and the Shatab sir, who was also there. He is also managing, and Chaitanya ma'am and everybody who were in the class throughout the day. Thank you to all of them, and thank you, very great thank you to Naveen, and most thank you to that sir, that because of him we are here and we are learning. So thank you so much sir, and really it was very fruitful session, I will say, with the flow of energy. The full flow of energy was there from your side. Yes sir, thank you sir. Yes ma'am. Sir, you are muted.
Yeah, it's time for Ritu ma'am to take our best wishes and take leave. She has to go to take care of her relatives, so let her go.
Sir. Yes,
so that
it
should not become a residential pathomechanics. Okay? Clinical pathomechanics should not become residential pathomechanics.
Yes.
Right?
Yes,
So good luck. Bye-bye.
Yeah, thank you sir. Thank you so much. Bye ma'am.
Thank you.
We'll meet again.
Yep.
Yes sir.
Soon.
Bye sir.
Right. Yes, Sujanya.
Yes, sir.
So what are you? Yeah.
Sir, I really enjoyed my day. I had a very long day today, but despite of that, I actually forgot even that it's 10:30, and I forgot my dinner, and my daughter got my dinner for me. That's how your session just filled my heart and my stomach as well today. It was really power-packed session. I'm so glad I have attended this, and all these days when we were doing like the short teasers or trailers, you can call it. I'm going to call this a movie that I watched today. So all the trailers that we have done today, and it is still going to be ongoing because there's more of the trailers that the people need to watch, and they need to know that there is so much to offer or receive in this course today that we have done. So I have really utilized my weekend today after my clinical hours. And this course has really eye-opened. Like Ritu ma'am has told most of it, and it is really an eye-opener and very detailed, evaluation of pathomechanics for, elbow joint and the SLR. I did miss the morning session due to my clinic, but I'm gonna watch that. I did watch it half in the break time, but I'll finish that video before we do the day 2 of our pathomechanics. Everything makes so much sense, and it's unfortunate when people don't take such valuable courses. I really enjoyed the movie today. It was great. Everything was so slowly structured for, some aspects we had to, where we didn't have much exposure in our clinical area. We had to think, and you were really slow sentence, so we could just grasp it, and you repeated it as well for us. So thank you so much for that. Every time I was like, can you sir repeat this now? And you just said it, so it was really good to reinforce that and understand how the connectivity happens with every, structure interdependence, myokinetic, kinematics, arthro, neural, and so beautifully designed, sir. I don't know how your brain works like this. It's so beautifully structured and delivered. Some people are just good at structure and keeping it in the books, but you have really delivered it. So it is going to be really valuable for us to apply it on the clinical area. I think I have more windows to check in my patient evaluation. I'd just not be limited to my old patterns. There is some more to check. So I guess I'll be more recharged for the next week of clinical evaluation of my patients. And I recommend anyone who is watching this live right now, you are missing out if you're not doing these courses. Like, it just takes you to the next level with your confidence of treating any patient that's thrown upon you. So thank you, sir, so much.
And to specifically mention that this is the first course which you enrolled actually.
Yes.
But before the course happened, so many courses you have taken, and you have also attended the daily pathomechanics webinars and things.
Yeah, I was desperately waiting for this one.
Acquaintance of 2008, and then I am again getting back to sir. I want to learn from him and all that. But now you are a clinical associate for the AOMPT, and you are getting the certification, course certified by Recovery Rehab Physio all the way from Sydney and Australia. So
yes,
I just want to show you the certificate.
Yes, sir. Can't wait to see it.
Okay. So it comes like this: Certified Clinical Pathomechanics Specialist course, Certificate of Appreciation. Pardon me if the camera is reverse direction.
That's okay.
Still it's fine. Okay. Otherwise, people will do screenshots and copy the design. Okay. Here you see that we have given details, the venue, the photograph, the initial description of the course and the participation, then the content of the pathomechanics course, what all it covered, and then the credentials and the verification email in the end. Okay. So, and most importantly, right here we have the AOMPT Clinical Associate and Recovery Rehab. So we have with the registration number, okay, Australia company number, and of course the ABN for the business number, and of course AOMPT's name with of course AOMPT's registration details follows this side. So it's a very, there is no space in the certificate. Okay, it is filled with a lot of not just the information, but also the relationship. Okay, across the continents, what we developed by the glory of knowledge. Okay?
Yeah.
And of course the QR code, the stamp, and of course my signature. These are routine. Yeah. And every certificate what we give as a specialist certificate or practitioner certificate should have a validity expiry. Okay. It should be like, you can give it even for 20 years, okay, maximum. So I have given the same 20, okay, or it is 30 years. So 2023 to 2053, okay. And when we are seeing that even at 2053, the content of pathomechanics, what we have shown, whether the world knows that or not, okay. So unless of course we are taking the courses and we are actually
continuing our education,
we are doing the brand ambassador work for the knowledge. Okay, so that's the beautiful certificate here for the clinical pathomechanics specialist course, which all of you will be getting, of course, more certified by Recovery Rehab Physio Australia. So congratulations. Of course, this is not going to be issued today because we have the day 2 and that is on 15th August, the Tuesday.
Yeah.
It will also again be the whole day one. Okay, so morning to evening. And the Monday evening, I am planning the osteopathy and the chiropractic manipulation, the practical demo. Okay, so that which was announced for 10th August, the Founders Day pre-webinar practical. So that I am going to take on the Monday evening. Okay, so that is going to be like 5:15, 5:20. So he comes after his work. If he is coming early, 3 or 4, it is more convenient for Ritu ma'am. So let's balance both the sides and see that practical webinar, which is the Founders Day webinar, so it has to happen on 14th of August. And of course, the day 2 of this course happens on 15th of August. And Independence Day, all of you will be getting certified. Okay, right? With, of course, the cutting of the second cake. Okay, so that is also to celebrate. Because attending 1 or 2 hours every day, you had felt that every session is better than the previous. But today's session, it will be totally above, and
Next
you will
level.
see the whole work from there. Okay, so like that it will be. You are retaining the knowledge, you are building it up with breaks. And we had tea breaks, the lunch breaks and all that, and it was going on. And amazing, we are gifted. It's worth waiting to get such a model for us.
Yeah.
Okay? Naveen, who was the PU student who was our model. And it's great. I was actually the first day when I was wearing this t-shirt and I was ready for taking this osteochiro, and then I got the model not coming, then cancelled. Then the next one, it was fixed for yesterday, the day 1 of this course. I wore the same t-shirt because it should not be like I wore this t-shirt and then it became cancelled. Okay, there should not be any negative vibes with the things which I am using. Okay. People tell it as lucky t-shirt and other things. Okay, so I tell it as positive vibes. And I wore it intentionally again yesterday, again got cancelled. Then I saw how many ever days happens, I will wear this t-shirt only and I will schedule the course. Because whatever negative vibes, wherever it is there, it will not stand in front of knowledge, which is the most important positive vibe of life. Okay, so and today he came, and I am absolutely happy that all of us, actually all you guys, you are blessed to actually get the best knowledge and the demonstration. So the best knowledge automatically best model comes to us. And with session happening all at a very short notice. Yesterday I just late night and all I was texting in the group that we don't know model is coming, not coming, cancelled. Okay, so all these things. Morning also it got delayed. Was planning to come in Instagram, then I changed the schedule, then I switched to every one of you as cooperative, like sir is also trying his level best. Let it happen, let's enjoy the course. Okay, and the moment we were on Zoom, everyone was there on Zoom, and it is like I can say that it's God's sweetness that He created such wonderful people to be associated with the Academy for learning and for actually applying the knowledge in reality. Okay, so you guys are the flag bearers, not just for the Academy, but for knowledge itself. Okay,
So, sir. Thank you, sir.
And congratulations for the day 1, and with best wishes for the day 2. And of course, for you, if I tell best wishes, it's almost like wishing myself. Okay, but anyway, it is the subsequent sessions which we'll see through, and we will explore the better and better aspects of knowledge in every course, okay, of the AOMPT. And trust me, your direct attendance through the Zoom definitely would have made you to actually explore the best of your own thinking process. What I was thinking in the previous, how you can relate to the thought, how this pathomechanics is actually the same thought which you thought before.
Yes.
And it will make you stronger to learn all techniques, because pathomechanics means all the techniques will come, okay, from that route only.
It's a great foundation.
So good luck to all of you, and
Thank you,
stay
sir.
rocking, keep inspiring. So we can close the session now.
Yes, sir.
Yes. you would
Thank
want
you so
to
much for your
address
time.
a few words for the viewers on Instagram?
Yes, sir. Again, I'll just say, people, whoever is watching live, it's a good initiative. If you can take, you can invest in yourself. Take AOMPT courses. It really adds value to your clinical practice, and just not gets a good name for you, and you builds up your reputation, but also it is just it's a good feeling for yourself of some sense of achievement that you can have on your personal level as well, of accomplishing great clinical evaluation. So I guess I place my career before my personal life. So it is something which I'm very passionate about. And so obviously for me, I get depressed if I have not evaluated somebody really well. So this is going to really add more value to my personal life in one way. So I'm just going to say that to anyone who's watching us, or please pass and share it on if you are not in a position to take the course right now, but feel free to share it with your friends who might be interested, and they can come in and join. And the other thing is, you should not be just interested, you should commit. That's what you should have in your life for growing. So commit yourself and see where it takes you.
Okay. And of course, this is the first ever batch in the world for a clinical biomechanics certification course.
Okay. So you're proud.
Which we have written history. There's a new page added today in the profession of physical therapy for the world. An exclusive clinical pathomechanics specialist course was not provided by any other organization in the past. And we have done that halfway through now, day 1, and day 2 is just another few days. And it's good time now to review the videos, apply it on patients in the middle of the 3 days or the 2 days, of course.
Yeah.
And have a stronger, inputs to discuss and to explore how well pathomechanics can be taken to more and more higher level. Okay? So, being part of the history and being part of this record-breaking initiative, it's all your decision. Okay, that first initial fire that you enrolled, and when I know that a physio from all the way across there and she's enrolling into pathomechanics, I was very, very happy that such a God-given course, pathomechanics, and the God-gifted learner who's across the globe is coming and enrolling. Okay.
Thank you, sir. It's just a blessing. God is kind, and God is kind. That's why he led me to you. So thank you so much.
Okay. So we'll most probably be meeting at in February or March in Sydney.
Sure, sir.
And
yes, sir.
And why? Because February is the anniversary of AOMPT itself.
Ah, okay. We should celebrate here, sir.
The 10th is the date when AOMPT was registered. Okay, in 2010. And February 14th was the date when neuromanual therapy was registered as an approach of the AOMPT. So to register neuromanual therapy, I formed the academy actually. Because I was taking course in neuromanual therapy, I had to certify. And I want an individual identity from India. So neuromanual therapy I registered. But organization to certify, why I have to ask another? So I formed manual therapy organization, which is AOMPT. So registered the academy first. Then under the academy, I registered the technique, the neuromanual therapy approach.
Yeah.
And that's the history. Okay, that the baby steps of the academy 2010 onwards, when I was working at Manipal University.
Right.
And it was a great 12 years of my global experience that time. And then around everywhere. Now almost it is 13 years. Okay, and it's 14th year. We are now stepping with, of course, no organization in the world has taken 363 free webinars. Okay, so we are the ones who are actually incomparable. People cannot even dream of reaching what service we have provided for education. Okay, not just 100 or 200. And we are targeting 1,000 free webinars, okay, by 2025, okay. So, and gone about personal records, but the maximum fulfillment comes when you guys are taking it up with the fire to lead the world, enlighten your subordinates, your colleagues, and friends around. And of course, the whole world becomes a brighter place. And physio profession itself deserves the identity that it can do the best as a holistic treatment, as a patient, as a single unit. Okay, even in functional independence, the cranial, visceral, and somatic, all these things are. You can see it on patients visibly, and you have been doing a great work applying all this on patients and getting back the same day. Okay, you are like you learn the course, you do it. If a patient comes, let's check it out. Yes. Okay, I want to see the strength of knowledge. Okay, yes. Also automatically when you are committed to knowledge, your hands-on skill, although it's not an offline workshop, direct training is not done, but still automatically your hands-on skill will come because the skill is generated here and it is done here. Okay. Many people think that we have to train my hands, train my hands. You train your brain, it will take care of your hands.
Yeah, okay? We are born creative, but people don't realize how creative we are. So I guess I don't mind I'm staying somewhere else and I'm watching this online. It doesn't really matter for me. All that matters is how much more I can improvise. And if I'm going wrong, we all add our own flavors to our techniques when it comes to, treating patients. So, of course, the main technique remains the same, but then we will grow with it. And then you're always there to support us, sir. If I have to just ask you sometimes, sir, I didn't understand this bit. And then I know you will respond back promptly. So thank you. That's a big thing I can assure you have got my back.
Yeah, absolutely. And I wanted to show the other one, which is also interesting. This is the certificate, and this is the transcript, which is designed for the clinical pathomechanics course at Pune.
Yeah.
You are going to get both. Okay.
Right.
So the certificate and transcript of the certification course for the clinical pathomechanics, and of course the specialist level both. So this is the day 1 is the certification course, and the day 2 is the specialist. Okay, the advanced level, which we are going to see. So it's a double bubble. Okay, you can say double dhamaka, whichever. Okay, you got certified, and since we clubbed both the batches and we are taking the content, and as I am taking online, we could cover more content in a single day. If it was offline, you can imagine the participants' level of understanding and the repetition, the practice, what they do physically, they want to do practice. That would have taken more than double the time. Okay. For this content, the same content would have taken 2 days.
Yeah.
Okay, so that is the point. Whenever we give credit hours, we give as the proportion of the value of the time versus the amount of content. Okay, so that is the proportion where we get the credit hours. So it's great, and I'm happy to certify you all with both. Okay, so today and of course, both this you will receive on the 15th of August. Okay, so you will get the soft copy for the online enrollments, and get your what is called as the energy multiplied, magnified to create the best vibes all around you. Okay, and stay as a source of inspiration for everyone, and the beloved child of the universal supreme power. Okay.
Thank you, sir.
Right. So good luck. See you, and we can close this session on this Instagram, and we'll get back with further sessions as we schedule. Okay.
Let's see. Looking forward to meet you again.
If tomorrow evening we are going to schedule anything. Okay. Let's see. Right. Otherwise, on Monday we meet and we'll get on with the osteopathy and the chiropractic manipulation, the practical webinar.
Sure, sir.
Okay.
See you then. Yeah, bye bye. Thank you.